Welcome to the Potent Mind, where curiosity meets clarity. Ever feel like your brain has a mind of its own? Here, we explore how attention works, why it drifts, and how to train it back, gently, powerfully, and on purpose. It's not about fixing your mind, but learning to work with it. Let's get started.
Welcome back to the Deep Dive. We are here to take overwhelming tasks, like, becoming well-informed, and give you the ultimate shortcut. Today we're tackling a search that is so personal and, honestly, just incredibly confusing for most people. How do you choose an effective psychotherapist?
It really is. It's one of the most fraught decisions people face when they're starting a wellness journey. Most people just kind of default to finding someone who's nice or maybe close to home. They don't really understand the clinical standards an effective modern practitioner should meet.
Exactly. So our mission today is to just cut through all of that confusion. We're going beyond the basic requirement of finding an amiable, supportive listener. We are focused on the evidence. We're looking for someone who's a skilled guide, who's committed to delivering measurable change.
We've distilled the research into a very practical 7-point checklist. This dive is really about raising your expectations. It's about moving past some of these outdated models toward methodologies that have been scientifically proven to be effective and, importantly, cost-effective. So by the end of this deep dive, you'll know exactly what questions to ask and, what qualities to look for to make sure your investment really pays off with actual progress.
Okay, so let's unpack this shift because it's a big one. Historically, the expectation was that the therapist listens, they reflect, maybe they help you understand your past. What defines a truly effective modern therapy model according to these sources?
Well, the foundational requirement is scientific validity. The model has to have been subjected to, rigorous studies and proven to work consistently. This is the difference between anecdotal success, where maybe the therapist is just a good listener, and clinical success, where the methodology itself is what's driving the results.
And that means we can actually name the specific types of therapy we should be looking for. For listeners just starting out, this list is basically gold.
Absolutely. The sources specifically highlight 3 key models that meet the standard. You have cognitive behavioral therapy, or CBT. Then there's dialectical behavioral therapy, DBT.
Yeah.
And acceptance and commitment therapy, which is ACT.
So what's the philosophical difference? I mean, why are these 3 considered so much more effective than, say, a deep Jungian analysis or just general supportive counseling?
It's the shift from why you are the way you are to how you can change. It's a huge shift. These effective models are goal-oriented, they're skill-based, and they are so heavily focused on the present and the future. They spend much less time intellectualizing your childhood history. Instead, the focus is on learning new skills, changing very specific behaviors, and interrupting those unhelpful thought patterns right now.
That makes so much sense. So instead of spending 2 years tracing the root cause of an emotion, you're learning a skill in week 3 that helps you manage it today.
Precisely. And to give you, the listener, a clearer picture, CBT is, it's excellent for challenging distorted thoughts that drive anxiety. DBT is often used for really high emotional intensity, focusing on skills like emotional regulation. And ACT is about clarifying your core values and then committing to live by them even when painful feelings show up. They all give you a real structured path forward.
Which immediately puts them in stark contrast with the older models, and a lot of very experienced therapists still use things like traditional psychoanalysis or just supportive therapy.
And this is where the sources get pretty pointed. When a session is purely listening, reflecting, and encouragement with no skills component or homework, the sources label that, quite memorably, I think, as HHT, hand-holding therapy.
HHT, wow. That's a strong label. I mean, is the research being a little too harsh there? Sometimes you really do just need someone to listen.
That's a fair challenge. And of course, support is necessary, but the point the source is making is that support alone is insufficient for sustained change. HHT might help you feel better in the moment, but it doesn't teach you the skills to handle the next crisis on your own. Effective therapy uses that supportive relationship as a foundation, but it builds a rigorous curriculum of change right on top of it. You should walk in expecting more than just amiability. You should demand a skill set.
And that leads right to the first major technical requirement, which is criterion 5 on our checklist. The therapist must be able to tell you exactly what kind of therapy they're doing. If they can't name the model, or if it isn't one of these evidence-based ones, that's a huge red flag.
Okay, so we've established the method must be evidence-based. Let's move into the specific interpersonal and ethical qualities that define an effective practitioner. We're going to cover the remaining criteria that describe how they actually deliver that method.
Let's start with flexibility. In a field that seems to require such rigid adherence to science, Criterion 2 feels almost contradictory. The need for open-mindedness.
It does sound like a contradiction, but it's really the mark of a truly competent clinician. Criterion 2 is encapsulated by this mindset of whatever works. If a therapist is so rigidly focused on their CBT manual, they might miss external factors that are blocking your progress.
So what does that look like in practice? What should they be willing to consider?
They should be open to investigating a really comprehensive range of options. And this includes things like, nutritional approaches, maybe the use of medications, integrating Eastern approaches like meditation or yoga, or even recommending group therapy or hospital care if the situation calls for it.
That sounds like a great question for an initial phone call. You could ask, if my symptoms stabilize but my energy is still critically low, what would you suggest we look at besides talk therapy?
Exactly. And if they get defensive or say, oh, we only do talk therapy here, that's a signal they might be too limited. They have to be willing to consult with others, a nutritionist, a psychiatrist, or, and this is crucial, refer you to someone else if it's not the right match. That willingness to step back and say, I'm not the right person for this, that's a profound sign of professionalism.
Absolutely. Okay, moving on to their delivery style.
Yeah.
Let's talk about Criterion 3, engagement. This is about their presence in the room.
You need a therapist who is actively engaged and engaging. They should be meeting you with energy, with curiosity. The red flags here are passivity, remoteness, or just emotional detachment. This is a dynamic process. It's not a one-sided monologue where they just nod.
Right. So if you feel like you're doing all the heavy lifting, prompting all the discussion, or you feel the therapist is routinely checking out, that's a sign they're not meeting the standard.
It is. They should be challenging you, offering insights, summarizing effectively. They should be collaborating with you on a strategy. A lack of engagement often signals a lack of investment in your outcome.
And that leads us directly to maybe the most uncomfortable but necessary one. Criterion 7, constructive confrontation.
This is so critical for progress. The therapist must be willing to confront you with things you might not want to hear. If they're just validating every feeling and never pointing out self-sabotaging patterns or blind spots, they aren't helping you change. They're just enabling the status quo.
So that's the distinction, right? How does a listener know the difference between constructive confrontation and just feeling judged?
The distinction is all in the delivery and the outcome. Constructive confrontation is always delivered in a way you can hear it, usually with empathy. And crucially, it's immediately followed by a strategy. So instead of, you're clearly avoiding your responsibilities, an effective therapist says, I noticed that when we discussed this, you changed the subject. That avoidance is likely impacting your goals. Let's work on a specific skill to address that this week.
Yeah. The challenge is always tied to progress. Okay, we've got the right mindset, the right method. Now let's look at the actual structural mechanisms that make therapy productive. Our sources put this huge emphasis on accountability through goal setting. That's Criterion 1, and homework, which is Criterion 6. This is the engine of progress.
Starting with Criterion 1, tangible goal setting. This is foundational because without clear goals, neither of you knows what success actually looks like. The utility here is, well, it's multifaceted.
Let's talk about the alignment factor.
Right. So goal setting aligns the entire treatment team. When the goals are clear, like reduced panic attacks from 4 per month to 0 in 6 months, you, the therapist, your psychiatrist, you're all rowing in the exact same direction. It just minimizes wasted energy on unrelated things.
And goals tie directly into motivation, too.
Yes. They let you track progress, which is absolutely vital. Research shows that tracking progress seriously increases motivation and self-esteem. If you feel like you've been in therapy forever, it's often because the goals were never clearly defined. And crucially, it helps you know when the job is done. It makes the commitment finite.
I think just knowing there's an end point is a massive relief for someone starting this journey.
It is. It transforms therapy from this indefinite commitment into like a skills training module with a clear graduation date.
Okay, let's move to Criterion 6. Homework. This sometimes sounds weird to people, but the power of the work between sessions is just enormous.
It's totally non-negotiable for real change. I mean, therapy sessions are only 50 minutes a week. If you're only applying these tools during that 50 minutes, your progress will be glacial because your brain spends the other 10,000 minutes reinforcing all the old, unhelpful habits.
And this is where the source uses that great metaphor. The session is mostly teaching. That's the classroom. The real world between sessions is the lab, the application.
Exactly. Homework ensures continuity. It keeps you thinking about and practicing the new skills in the environment where you actually experience the stress, the anxiety, all of it.
So what does this homework look like? Is it just journaling?
Oh, it's way more specific than that. Homework often involves logging specific triggers, practicing grounding techniques for a set number of minutes per day, or consciously delaying a habitual reaction like sending an angry email or experimenting with a new response. These small daily applications are what actually rewire your brain. If the therapist isn't assigning structured homework, they're missing the engine of change. So we've covered the 7 core criteria that move a therapist from just supportive to truly effective. Now, the source lists pluses. These are the extras to look for that can really enrich the process and lead to deeper, more lasting results.
These are the things that signal a clinician is operating at a higher level of integration, right? What are the 3 pluses?
The 3 pluses are: 1, they actively offer specialized coping skills training. 2, they use a mindfulness-based approach, which is just crucial for present moment awareness. And 3, they operate from a comprehensive perspective: biological, psychological, social, and spiritual.
Okay, that last one, biological, psychological, social, and spiritual, BPSNS, that covers everything. We should elaborate on what that really means, especially the spiritual part, which can be misunderstood.
Absolutely. A BPSNS perspective just means the therapist recognizes that we are not just a mind in a vacuum. So they look at the body biological factors like sleep, diet, exercise, the mind, your psychological patterns, your relationships and environment, the social factors, and finally, the spiritual.
And by spiritual, we're not necessarily talking about religion.
Correct. The spiritual component in this context really refers to meaning, purpose, and values. Are you living a life that's aligned with what you genuinely care about? Are you wrestling with those big existential questions? If you ignore that dimension, you might fix the anxiety, but you won't fix the underlying sense of emptiness.
And it works the other way, too. If they only focus on the psychological, they might miss a glaring biological factor. Like if you have severe chronic sleep debt, no amount of CBT by itself is going to fix the exhaustion that makes you emotionally reactive.
That's the key synthesis. If you're coming in perpetually underslept, the emotional regulation skills you learned are almost impossible to deploy effectively. The effective therapist integrates physical factors and social context into the treatment plan, knowing that wellness requires a multi-pronged approach.
Yeah, the sources really drive home this idea that health isn't found in one single fix.
Exactly. It requires integrated work: self-examination, reprioritizing values, specific behavior change, and physical maintenance. The effective therapist isn't just treating symptoms, they're guiding you toward that integrated wellness. Hashtag tag outro.
This has been a deeply clarifying deep dive into what true clinical effectiveness actually looks like. So you now have the 7-point checklist, from demanding an evidence-based method to insisting on goals, homework, and constructive confrontation that moves you beyond just settling for basic support.
So what does this all mean for you? Well, the search for a therapist is fundamentally a search for a highly skilled professional who is committed to measurable progress. Demand their methods, demand their accountability, and expect them to challenge you constructively in the service of your goals.
And as we close, here is a final provocative thought for you to mull over, based on what we've covered today. If integrated wellness requires that multi-pronged approach, covering the biological, psychological, social, and spiritual how, might integrating an Eastern approach, like mindful self-compassion, specifically complement and enrich a purely evidence-based therapy like CBT, which can sometimes focus so heavily on rational thought. Think about that bridge between structure and serenity as you continue your journey.
Thank you for joining us for the deep dive.
We'll catch you next time.
Thanks for listening to The Potent Mind. If today's episode sparked insight or helped you refocus, consider subscribing and sharing it with someone you care about. For more resources or to connect, visit thepotentmind.com. Until next time, be kind to your mind.